Welcome to Building Something Admirable, the podcast that takes you behind the scenes of how to start a healthcare-related business. I'll share each step that we took to establish our now thriving practice at Admirable, including our highs and lows, insider advice, and real-life lessons in every episode. Good evening, budding medical entrepreneurs. This is Alex. Thanks for tuning in today. So, let's have a conversation. Pricing for a value-based program. Now, in a medical practice, it's a private practice, if you're shooting for any sort of program that is kind of comprehensive. So, in our case, as I mentioned in our more recent prior episodes, we're going to switch from an entirely insurance reimbursed model to a membership model, mixed membership and insurance reimbursement. Okay. So the reasoning for that is we can't provide the level of service that we want to provide in the current environment. That is just life. Unfortunately, that's, even though it would be lovely to be able to do that, we just can't do that in this system. We're not the only ones. It's kind of the way it is. I've covered that ad nauseum. I need to stop spending the first 15 minutes of every one of these episodes bashing the healthcare model in this country because of the inequity it creates. So let's move on. When you're designing any sort of program for a service, I mean, it probably works for product too. It's just not my area right now. I'm speaking from my experience in this typically. So when you're designing a pricing structure for your product or service, there's no benefit for being the second most expensive product or service in the market. That's loosely based off of a Dan Kennedyism that's been repeated by Alex Hormozi and Russell Brunson. Basically, the idea is if you're the most expensive, that gives you all the extra ammo you need to provide that added layer of value for your patients or clients. In our case, this totally applies in the fact that if our original idea for the pricing was going to be $99 a month roughly, or $250 a month roughly for a membership only, or a membership plus all the services included program. So if we do it that way, when I'm looking around the market in the area, and there's a couple similar private practices that have analogous models. Roughly from my memory, most of them have their structure as looking at the different practices in the area that focus on weight loss or hormone replacement or other areas of wellness here. We typically seem to be coming at or under the cost of the others, yet offer a similar level of value or higher. And to the untrained eye, that's great. You can be competitive and, undercut everybody else. But they've already got established practices, so we'd have to, 10x their level of service just to try and keep up. And we can't 10x their level of service at the same or lower price. So one thing's going to have to give. Either we're going to have to provide less services, which defeats our purpose, and we end up being a middle of the ground and serve nobody kind of problem, or we have to raise our prices. And in this case, I think you really want to raise your price to the point where it makes you hold your breath for a second when you see it. But we're not trying to appeal to the entire state. We're not trying to appeal to half the state. That's obviously the right age demographic and all that stuff. We can't even take that level of volume. We want to basically add on just enough patients that we fill the practice. And right now, that's not going to take that many patients to do that. So we want to basically price it up to the point where we add 50 people to the practice in the next month or two, or 3, frankly. If we add this new pricing model and add even a handful of people the first month, that's a success, because A, it shows some element of product market fit here, or service market fit, and secondly, will also demonstrate that we can then start pulling on different levers to enhance this further. So if we have a couple people who like this, then that gives us a little bit more breathing room in our budget, which then lets us add additional services, hire additional staff, which then lets us provide more services so we can add more people. As we add more people, then word gets out that, hey, these people are worth the money, kind of thing, and I'm getting results and I've never felt better and all that kind of stuff, which we know we can do as long as we can see these folks and still get home and sleep in our own beds at night. Now, more broadly, when you're looking at pricing, there's a lot of ways to actually pick a price. There's a cost plus model, which is you take the amount of, you add up all of your expenses and then add on some percentage, or individually you have certain services and it costs you X, you mark it up 20% and charge everybody else Y. That margin bakes in the cost of delivery here, whether it be putting the lights on or paying for the labor involved for whatever that service or product is, etc. That's one way of doing it, and it's not the best way to stop the hamster wheel of going for volume on these kinds of things. You really want to be, you're not, if you're doing a private practice or private service, you are not going to be the Christiana Care, UPMC, Hunter Medical Center, whatever major system you have. You're not going to be an office of one of those that have the economies of scale effectively subsidizing your individual practice. You got to do it all yourself, and so that kind of a model, it just can't really work comfortably. At least it's not the easiest way to do it. A far better way of doing this instead is going to be a value-based model. So what outcome are you delivering here, and how much is that worth to somebody? And that is a lot more obviously nebulous of a number to pick, but it also has the benefit of then being kind of tailorable to the market. So if you go to do this model and you get far more demand than you intended, well, then it's like, hey, I've mispriced this. The market supports a different price. All right, time out. Good afternoon, budding medical entrepreneurs. Thanks for tuning into the Building Something Admirable podcast. My name is Alex. Our weekly strategy session this time was to address the membership model that we're going to be introducing. So, to recap, basically the idea is it's going to be a monthly fee that covers most services at one tier, and that's going to be covering any labs, meds, obviously access, gives patient access in terms of faster appointments, direct outreach to Angela and me, easy scheduling, all that stuff. And then that's for one higher price, and the lower price is going to be just the access stuff, and then a couple extra little perks here and there, and like discounts to anything in the office, all that. Session went well, and it was exactly kind of as I anticipated. Each one of us came with a slightly different perspective. Angela, Lauren, and myself were more on the daily operations business side of risks and benefits here. Kelly asked really good questions, and not really from any one perspective, but definitely had some good points in terms of, for your reducing copay amounts, well, by how much, what will be a good perceived benefit to the patient, but also not actually biting us in the butt. So I was originally going to say, what if we cover copays, and as an aside for compliance, when you're going to do any sort of a copay waive, you can't just do that willy-nilly or empirically. So what ends up having to happen is you have to collect some fee monthly. Not a lawyer, we'll start there. from my understanding, is to collect some sort of fee, but then you end up having a disclaimer somewhere that says this fee applies to non-reimbursable services, which will include co-pays and whatever else isn't reimbursed. Yeah, so if we did a straight up waiver and not of an absolute amount and not a percentage reduction, what could end up happening then is we actually could be in a place where we lose money on this deal if we have someone who has a high copay of some of the highest we've seen so far been like $65. If we don't collect that and somebody has 2 appointments per month, right there we end up losing money. So that was a good point that I hadn't thought of fully, and so that's something that I just don't see every day. So it's perfect. The whole reason why we do these full team meetings to tease out new ideas. And as anticipated, my wife seemed to revel in trying to argue with me over points that I was making. So always productive conversation. The beauty of it is even when she was doing that, it did force me to re-articulate my points well and be able to answer these questions kind of from any angle. And really, whenever you're doing something like this, you want to be able to do that because you're going to have to, you have to defend these things. You want to basically be able to explain or defend it in your sleep, because in some cases you're going to have to be able to defend it, pretty aggressively. So the other thing that we're kind of stuck in doing here is we may be offering some sort of special deal to a local retailer that we met at one of our table events where we sponsor a table at the Health and Wellness Fair, and there are other vendors in the area, and a representative from this one retail chain was trying to find a deal for their employees. So now we're going to be bringing that to them next. I mean, I guess I'll talk about it a little more vocally once I understand if we're able to talk about it vocally, which obviously we can, and once it's finalized. But we need to basically make it look like this deal to them is going to be worth their time and effort, and not something that they're going to propose to their employees who are going to be like, I can't afford that. Are you kidding me? And it ends up biting all of us in the butt, despite best intentions. So that's the last kind of piece of this concern is, we got to do this pricing, then offer them a discount, but can't defeat the purpose of doing the special pricing. So, say we knock it down half off here and we do $100 a month, well, that ends up being $50 a month, which ends up being, not that special of a deal if we do end up seeing 100 patients at $50 a month. That ends up being an extra $5,000 a month, which is not nothing, but for $60 grand a year to suddenly fill our schedules in the complete near term and then not to be able to even service these patients, it's kind of a problem. So that was the last conversational piece at the end here, is how we're going to offer this deal to ex-employees. And now in hindsight, I'm like, we got to reprice this whole thing because it again needs to be worth it. We need to be able to price it so that the supply-demand equation shifts to an intersection that makes sense for what we can service as a practice, which off the bat is an influx of maybe 50 new patients on top of our current patient load with our current staff. Eventually, the idea is that this new cash flow will let us hire more staff. And there certainly is always going to be an element of, if you build it, they will come, or chicken and egg, or cart before the horse, or whatever analogy here. But if we sign up a bulk of people en masse and they go to sign up and can't sign up, then we've already failed on one of our promises. So my big thing is to under-promise and over-deliver, especially in a practice where there's a membership fee. You want to be it's a better position to be in to have only a small amount of demand for a higher fee, but be able to wow those folks. And so far, we've done very well by our patients in terms of outcomes. But if we take on a big block of new patients and suddenly can't actually take care of them, our outcomes are going to go down, our access is going to go down, our income is going to go up only slightly, and we're going to take a big hit in our reviews for this. So, everything is going to be an intersection of all these points here. And I think the big thing we'll do is price it, appropriately high, so it's intentionally restrictive. We intentionally want to make sure that only a handful of people can justify making this investment to start, and then after that, it will make more sense for everyone else to join once we use that initial bulk of people to fine-tune the process, hire the staff necessary, and then slowly and periodically open the gates here. Again, we don't want to take on more people than we can handle. We don't want to underprice and then have to raise our prices later. That's the worst place to be in. But the second worst place is going to be if we have to lower our prices later. So I'd rather be at a place where we have less demand than we anticipated, but the folks that we have are going to be very, very well taken care of, and any free time we have because of this is going to let us do the other stuff to generate demand. So in the end, it kind of makes sense, and I think that that's the direction we're going to be going in. But I look forward to updating all 3 or 4 of you listeners when I have more to say about this one. More to come. I hope you got something out of this one. Please leave me a comment below so I can tailor some of this content towards whatever interests you and can be most helpful to you. There may be some topics that I gloss over that I think either I've talked about too much already or whatever it may be. So I'm definitely going to be reading what anyone has to say about this, and can tailor some of these conversations specifically to what needs to be said. All right. Thanks for listening. Best of luck. Stay tuned for more insider advice on building something admirable. Don't forget to like, share, and subscribe below.